show from Senior Perspective. Today I have a wonderful program that is going to be very interesting to everybody, and I hope that we can make you realize what a wonderful program this is and how we can benefit it by all. And I would like to introduce my guest, Joyce Ferri, and maybe she will tell us about what this program is all about.
Thank you, Erma. It's a pleasure being here. Today, I wanted to tell you about the health fair that we're having at St. Benedict the Abbot Church. It's going to take place on September 30th, and we have a guest speaker by the name of Father Scott Seathaler coming. He's a Franciscan Capuchin priest. He is a wonderful speaker. He's going to talk on seniors and the aging process and what it's like to reflect on the years that we've had with a Christian perspective there. And Father will talk at 10 o'clock in the morning on the 30th, that's a Thursday, and he'll speak for about an hour from 10 to 11. And from about 11 to 11:30 he's going to answer questions. Okay, and then following that we have a health fair in our hall, our church hall, which is called O'Brien Hall.
And now, excuse me, but this is going to be just the speaker and the question and answer period. It's not going to be a mass.
Correct.
Okay.
Yes, it's just the speaker and questions and answers that will take place in the church. And we have it in the church because we can hold quite a lot of people in the church. And everyone in the community is invited. It doesn't matter what faith they are. This is open to all. It's free. There's no charge whatsoever. And following that, we will have the health fair in O'Brien Hall. And we will provide some light refreshments, healthy refreshments, since this is about, you know, the health issues that seniors faced in these years, along with spiritual emphasis for the seniors. And our health fair will last from 11:30 until 1:30 in the afternoon.
About 2 hours.
About 2 hours. We have about 40 vendors coming.
Isn't that marvelous?
We are so excited about that. We just have so much to offer everyone.
Yeah, nobody really realizes how much help there really is out there.
Yes.
And this is one way of finding out that there is help out there for anybody that has problems of any kind, really.
That's exactly right, and that's one of our goals for having this health fair. We did a survey of the parish and what the needs were, and we identified several areas. One of which is how to get people the help that they need. So through our health and wellness ministry, we're going to try to hook people up with community resources, or perhaps a social worker, or people who volunteer their time to go into the home and help other people.
That is the hardest part, really, to get people to realize that there is help out there, and for them to really come forward, because that's the only way you're going to find out if people need help.
That's correct. You know, Bishop Zubik said in one of his pastoral letters that at some time in our life we all need help, and we should not be ashamed to ask for that help. Some of us need help at some time, and others of us are able to give that help. And it's really all about good stewardship and sharing the gifts and the talents that we have.
That's right.
And that's what we hope to provide through this health ministry, and by allowing these vendors to come in and show everyone what they can do for them and how they can help them with situations that come up in their daily lives.
Right, and it's surprising, I know from experience, that because I used to do the Helping Hands when we had that program going on, and it was so hard to get people to realize that there are people out there that will help you. And I'm so glad and thankful that this has come about, because I think it's really needed, and because there are people out there that need help. They're just a little timid about coming forward.
Yes, they are.
And that's and I think you guys will do a good job.
Yeah, we hope to allay their fears about this too. You know, what we do in the church through our ministry is strictly confidential. No information is ever shared with other people. It's when you come to talk to one of the nurses or you call us, we keep that confidential, just like we do if we were working in the hospital or a nursing home. And other people in the church are not privy to that information.
Right.
And we have quite a network in our own church to help people with a lot of other ministries. We're prepared to help people who have perhaps lost a job and or who are, say, underemployed. They need some additional income, need to find another job. We have a wonderful ministry there called the Hope Ministry that will help them with that.
Yeah, I read something about that in the bulletin, and it really
Yes.
sounds like it's something that is really needed,
Oh,
especially today.
It's wonderful.
And that's,
You know, we're also working with Abbey Ministry, which is a neighborhood group of people who will work within a given neighborhood. Because, you know, when you get sick or you have a new baby or there's a crisis, perhaps a death in the family, your neighbors are the first ones to find out about it.
That's true.
And we need that information to come back to the church so we can all pitch in and help everyone, whether it's preparing a meal or possibly transportation. You know,
It's all those little things
It
that
is.
Are big problems at that time.
yes, it is. And when people are in crisis, you can't always think clearly. You don't always know what you need.
That's true.
So by having a network of people there to say, well, why don't we do meals, or why don't we do some babysitting for someone, hopefully we'll be able to help in a lot of different ways for people.
So well, it's a wonderful, wonderful idea, and I just hope that everything goes along well for you and that it really takes off, because I think it's really something that is really, really needed. And it's, you know, you've got to present it in order for people to know it's out there, and
That's very
there's
true.
a lot of them don't realize what's all out there for
Yes.
you.
You're
And,
exactly right about that. We have a lot of dedicated people who are so anxious to go and help other people, and they're putting in a lot of time and energy. And I think that this will be welcomed in the community once we get the word out there to help to let everyone know.
Well, perhaps we should better get back to this health
Okay.
fair. See, we're start at the beginning.
Okay. All right. Well,
That's,
again, with our vendors that we have Jefferson Hospital coming in. We have Washington Hospital coming in, and they're going to do several programs on diabetes. They will have information there. Also, women's health issues, and they'll have some information about urgent care, which is their unit on Route 19 by Eaton Park.
Right.
And you know, that's a nice place to go if you need some medical services, but maybe you don't want to have to go to the emergency room to
Emergency
get
room.
them. It's not a real emergency. So they'll be in there talking about that. We have vision screening that will go on.
Oh.
We have someone
okay.
coming from the Washington County Blind Association. And we also have a company coming in that will do auditory screenings. We have bone density screenings going on so that we can help people with osteoporosis, give them information as to what they might be able to do to help that. We have a nutritionist there, a dietitian. And she works with our group at the church too, and she's got a lot of information to help
Yeah,
seniors.
the information's out there if you only follow it. That's the hard part.
That's true. Sometimes it takes a little more than the nutrition. It takes a little bit of a lifestyle change to help.
Definitely.
Yes. And
I hear you have a chiropractor coming too, or something?
we do, yes, and he's got some brand new information on osteoporosis and exercises that can be done, which he has found out will actually reduce the osteoporosis that you have.
Oh, that's
and it's
interesting.
not vigorous exercise like, you know, how we say, well, we don't want to get on that treadmill, you know, we don't want to have to lift weights. This is a very gentle form of exercise, and it only has to be done once a week, from what I understand.
Oh, that
So
sounds
that's very
good.
exciting, isn't it?
Yeah,
We all would like to exercise once a week
Once
and
a
get some
week, yeah.
benefits.
That'd
Yes.
be great.
So I'm looking forward to seeing what else he has to offer there. It's brand new, cutting edge chiropractic. So I'm excited about that.
It sounds wonderful.
Yes, and let's see, what else do we have? We have some home care companies that are coming in to let people know what they can provide in the home, whether it's a nursing service or possibly a skilled aid service. Sometimes speech therapy is needed or occupational therapy. And the one thing with occupational therapy is when people are in the home, sometimes they don't realize the little things that they can do that save them energy or will allow them to maintain a function at home that they want to do with just some small assistive devices. Instead of bending down on the floor to pick something up, they have these nice little pincher things, and I like those too. I have them at home. Help me get things out of the cupboard.
Yeah.
And
Well, wait till I tell you what I used mine for.
what do you use yours for?
We had a pear tree in the back,
Oh.
and I hated to bend down and pick those darn pears up off the ground.
That's
So I got my
wonderful.
little thing, and I picked the pears up and put them in a bushel and then took them away that way. So you can use it for a lot of things.
That's right. And do you know they even make something to help you put your socks on?
Oh, yes, I have one.
Do you have one of those? Aren't they wonderful?
Oh, it works. It really works.
Yes.
The
So
only
there's-
thing it doesn't work on those stockings that you have
Yeah,
to wear
those
sometimes.
stockings. Yeah, nothing helps with those.
Nothing helps with those, yeah.
But there's a lot of devices that people could use in the home, and again, it's just knowing that they're out there, and that you can benefit from them.
Well, there's one also where it helps you get into bed. I mean,
Yes.
you can lift your leg up with this device, and
Yes.
it helps you to get into bed.
But isn't that nice that you can stay home in your own home then, and
manage.
that's right, and be comforted by the things that you have around you that you've had for your whole life. And that's very important. We also have someone coming in that will have information on insurance, retirement.
Oh, that changes all the time.
It does. It's very hard to keep track of everything that's happening. A lot of Medicare changes and other insurance changes. So we have that.
I think this is the time of the year when they talk about the changes or something, isn't it?
Yes, fall.
Fall.
Change your batteries, change your change everything.
Change your lifestyle.
That's right.
Change everything.
Yes, get prepared.
Yeah. So,
We also have someone who is going to come in from Beinhauer's.
oh,
And they have a lot of useful information for people who would like to pre-plan things, and rather than having to wait and kind of be in a crisis situation and it's more difficult to make decisions.
I know I had hospice for a number of years for my husband.
Okay.
And that's one of the things that they did when they mentioned it to me about making preparations. And I thought, oh, I can't do that. I mean, I'm pushing things. I mean, I can't do that. And then they talked to me, and I realized. And that was the best thing I could have done.
Yes.
I mean, when it finally happened and everything, then everything was taken care of. And it was just so much better than if
It is. It really
than
is.
if
And
you go
you
into it
get
cold.
what you want. Then so many people nowadays really do want to plan their funerals. They're actually choosing their own music.
Oh yes,
They're,
I've heard of them doing
they're choosing
that.
a lot of things that they want, and that's a good thing for them. Okay.
So well, we don't want to talk about that.
Okay.
Now. So we want
All
let's keep
right.
people healthy.
We have the Peters Township Police are going to come in and talk about safety in the homes, things that senior citizens, how someone will come in and pretend to be somebody else just to gain access to their home. We're going to have the fire department there too, so we can talk about prevention. Okay, we don't want them there to visit you for a fire. We want them to help you prevent
It.
accidents or fires in the home. We have Meals on Wheels coming in,
Oh.
and
mhm.
they
That's
do a
great
wonderful
program.
service,
Yes.
don't they?
Yes, they do.
And we have so many shut-ins in the community that could benefit from some of these services. So hopefully they'll get to see your show, and
hope so.
we can
Hope
get
so.
information to them too. Okay.
So
We have the Peters Township Library coming in. They have a wonderful program for shut-ins.
oh
Where
really?
you can order books
Oh.
and tapes. So, we can have those delivered to your home. It's very nice.
So what else?
Well, we have massage therapy. We're going to have a massage
now you're
therapist
talking
there.
about it.
I think she's going to be have a lot of people in front of her table there. Everybody's going to want to have a massage and relax.
That's did you ever have one?
No, I've never had one.
Oh, they're wonderful.
Are they?
Oh, I even had the stone massage, and that is
Oh.
that's even better.
Okay.
And that's but they use hot stones and put them on your back or whatever.
Okay.
And so it's we'll probably continue. We'll right now have a commercial break, and then we'll continue again in a few minutes.
Okay, thank you.
Okay.
My name is Casey. All my life I knew I wanted to help others, but I didn't know how. AmeriCorps provided an outlet for me to be the change I want to see in the world.
I guess we're back again, so we'll give you some more information about the health fair that's coming to St. Benedict's, and Joyce will tell us more things that's coming along. So Joyce, you know, I was thinking about this, and how did this all come about? I mean, what was the reason for putting all this on?
Well, one of the reasons, Erma, was that when we did the survey in the parish, we identified certain needs that people in the parish thought they needed, and one of them was in information. You know, how can they get health information? And so we started talking about doing a health fair. And as it turned out, Bill Bacca from Gateway Hospice happened to call Dennis Gerline, our pastoral associate, and was telling him about Father Scott. And so we presented the idea of having the health fair and having Father Scott come and talk, and that's really how it got started. And from there it just kind of snowballed with, you know, asking people if they'd like to participate in the health fair, and we've got quite a group now.
Well, I know he's a very good person to get things rolling.
He's so exciting, isn't he?
He is, he really is, and he's very interesting to listen to.
He's funny too,
yeah.
Isn't he?
And in a very informative way.
Yes, yes.
And it's surprising, and he does bring people in.
He certainly does,
Yeah.
yes.
So,
So
when did all this start? When did you start working on all this? It must have been some time ago.
Well, we probably started, I think around February was when we first started talking about it. Mm-hmm. And of course we had some bad weather then, so you know, it was difficult to get together and do some planning. But by springtime we were pretty much off and running with it, and you know, through the summertime we started to talk to people out in the community that we thought would come in and have useful information for seniors to benefit from.
Mm-hmm. Now, like you say, you had it pretty well lined up in the spring. Mm-hmm. Which we hope you have it again next year, when should people get in touch with you or something if they want to participate in this?
Well, they could actually get in touch with us at any time, and we can put that in a file and then notify them when we would be having another health fair. Mm-hmm. We would certainly keep a file on that, and of course we would welcome anyone who would want to participate.
That could help.
Yes.
Mm-hmm.
You know, and perhaps in the future we would want to do something that would be geared towards children or young parents, a health fair for them.
Well, yes, we're a very young parish.
Yes, we are.
And I'm sure they have problems too.
Exactly. We really would like to be able to meet the needs of everyone in the parish. Mm-hmm. So we'll certainly be looking for ideas for that.
You've got your hands full. Big job.
Well, it's a big job, but we're very fortunate that we have a lot of dedicated people who are working very hard to help others.
Mm-hmm. Okay, well, perhaps maybe you could mention again when the health fair is and the time and all, and just to reiterate, mention again. Excuse my English.
The health fair will take place on September 30th. That's next Thursday. And it will start at 10 o'clock in the morning. It will start in the church, St. Benedict the Abbot Church on Abington Drive. And it will last about an hour and a half at the church with Father Scott. And following that, everyone is invited to O'Brien Hall, which is our church hall. And there we'll have the health fair. We'll have some light refreshments. And people can take their time going around to visit with different vendors, have some testing done if they'd like to, have their blood pressure taken, a pulse ox. We're going to do that. Make sure you have enough oxygen when you're breathing, you know.
What's that?
That's just putting that little thing on your finger, that little, and it'll tell you how your oxygen level is. And a lot of people will be doing blood pressure screenings so that we can help. So anyone who, would be interested in having their blood pressure taken, they can just come by and even have that done. There's no fee at all for that. Everything's free. We're also going to have flu shots and pneumonia shots. Anyone interested in that just needs to bring their insurance card, and there will be nurses there, and they will administer the flu shots and the pneumonia shots.
You have the flu shots already then? I mean, they are available?
They are available, yes. There's quite a few places right now that are already starting up to do that.
Yeah. That time of the year.
It is. But better to be safe,
Very
right?
safe than sorry.
We don't want anybody getting sick.
Right. So.
Now, we also, one of the other co-sponsors of this is Comfort Keepers. And they're a good organization. They send people in the home to help in various ways, with home health aides and nursing and other services. So they are co-sponsoring this with Gateway Hospice.
Okay. Are they affiliated with the Washington Hospice, or is it?
No, it's
just
separate organization.
Separate organization. I didn't realize there were so many hospice organizations out there.
Yes, there are.
And that's, but it is a wonderful organization, and nobody can tell me they're not, because I've experienced it.
Oh, you have? Okay,
Yeah.
that's right. Yeah, with your husband.
Yeah.
Okay. All right.
So, well, is there
Right.
something else you can think about?
We do have an organization coming in that will have assistive devices there. Progressive Mobility from Washington is coming.
Yeah.
So they'll have some information there for people too who might need something in the home with the stair climbing assistive device, and the chairs that kind of rise up and get you on your feet again. So they have a lot of information like that to share with people.
I hate to ask this, but do you have someone coming that you have I fell and I can't get up?
You know what? No, I don't think we do. No, I don't. I could be wrong, but I don't believe we have anybody coming for that. There are a lot of companies out there, though, that do provide that service, and it is worthwhile.
Yeah, I know. I'm thinking that, but yeah, it is something to be prepared. And I guess it doesn't say that you're getting old, but
No, it doesn't say you're getting old at all. It just says that I need help right now for some particular reason. You may not have fallen, but what if you were choking?
Yeah.
Or
Well,
felt a
true.
little dizzy, and you were able to get to a chair and sit down, but you need somebody to come in and help you.
See, it's only, yeah, you're right. It's not
And
only
that
falling.
can be at any age.
Any age, yeah.
Yes.
So, okay, is there something else that comes to your mind?
I hope I've covered everything.
It sounds like you've got a lot of vendors.
We do have a lot to
everything.
offer. We really do, and we hope that everyone will come and take advantage of it, and make a day of it and enjoy themselves.
So, I can't think of anything else.
Okay.
Only that we want to say the time and the date again.
Okay.
And it is September 30th.
September 30th. Starts at 10 o'clock in the morning. Father will talk from 10 to 11:30, and the fair is from 11:30 until 1:30. And remember, we do have some light refreshments. So please come and enjoy yourself. This takes place at St. Benedict the Abbot Church at 120 Abington Drive in McMurray. That's off of Valley Brook Road. So please come.
Yeah, and it's not hard to find.
No, it isn't.
I mean, we have a big sign, St. Benedict's.
We're behind the dairy bar.
Right.
If you can find the dairy bar, we're
You're
behind it.
not too far away.
That's right.
So, well, I really can't think of anything else unless there's something else that.
I think I've covered just about everything.
So,
Now we do have the group coming from Mercy Pittsburgh, and
Mercy Hospital's coming?
they're called the Pittsburgh Mercy Health System,
Oh.
and they provide a lot of services for the needy. But they're coming to our health fair to let everyone know about the parish nurse program that they have, where they actually do the teaching of the nurses who want to become parish nurses.
Oh, that's
Yes,
Yeah.
it's a specialty that you can enter into as a nurse. It's recognized by the American Nurses Association, and it takes extra training in spiritual care as well as the professional nurse side of it, the science part.
I don't know whether you want to get into this or not, but even this is besides the fair. Is there going to be a program or something where people can get in touch with your organization or something other than the fair?
Well, yes.
I don't know if you want to get into all that or not.
Well, you know, I'll be happy to mention it. Our health and wellness ministry will have an office right inside of our church building. As you come in the front doors of the church, our office will be right on the right side of the church, first door on the right. We will have office hours, regular office hours there, staffed by a nurse. And we are in the process of getting our own telephone number, a dedicated telephone line for the health and wellness ministry that nurses will answer, so that anyone who wants to call in and ask a question or has a concern, you can discuss it with a nurse, and it will be confidential. We do have a locked file cabinet there. The room is locked at all times, other than when it's in use by someone there. And we do protect all of our information, just like when you go to the hospital or in a nursing home.
Well, that's wonderful, and I think it's something that should be addressed, and that so that people know that the help is out there.
Yes, yes.
Because there's so many times that you need help and you don't know where to turn.
Oh, absolutely.
And you should that would be a point.
Never be embarrassed about asking for help. You know, the Lord really wants us to help each other as we help ourselves. And that's what the church is about. That's what our ministry is about. And we have a lot of people there who want to help. So please ask for help so we can come in. We can help you with your physical needs. If you're in a crisis and under a lot of stress, sometimes it just helps to talk to somebody about that. And we're willing to listen and visit with you and take the time. And we'd also like to meet your spiritual needs. We can come in and pray with you. We can read with you, read the Bible with you, or say a rosary if that's what you'd like. So we're here to meet all of your needs.
Mm-hmm. Which is a very wonderful idea, and it's too bad it's taken so long to come alive, but here it is now. So,
yes.
And we should all take advantage of it, because it is something that is needed and something that is worthwhile. And that's so I'm so glad I met up with you, and I hope
thank you so much for having me here.
You know, that more people will hear about this and, you know, get things going, and that. So, and that. So, well, I can't think of anything else.
Well, thank you very much, Erma. It's been a pleasure.
So, unless you want to one more time, tell them when it is and all that.
All right.
Okay.
Okay. September 30th at 10 o'clock in the morning at St. Benedict the Abbot Church in McMurray at 120 Abington Drive, which is off of Valley Brook Road, right behind the Dairy Bar. We're easy to find. And the telephone number's in the book. It's 724-941-9406. So you can just call that number if you need directions or you have any questions.
Mm-hmm.
All right?
Okay, so it was wonderful having you on the program, and to know that things are out there for us, and we all need help at some time or another, and we should not be afraid to ask for it.
That's absolutely right.
Because that's what we're here for.
And it spans all ages. If you're a new mom, if you're a teenager, you know, if you're in middle age, we all need help at some time.
Mm-hmm. The age level doesn't matter.
It doesn't matter. Mm-hmm. That's right.
Mm-hmm. So, well, I can't think of anything else, and that's and I wish you the best of luck, and that we get a lot of people coming, and that this really goes over good for you.
Thank you so much.
Because it's something that we need to be put out for the people to know.
Yes,
and
for everyone in the community.
Right, right. Mm-hmm. And it's something that I myself have been hoping for, that we could get some help, and to let them know that there is help out there, and that you're not alone.
That's correct, yes.
So, and thank you very, very much for coming, and lots of luck on your program.
Thank you, Erma.
Mm-hmm. This is Erma Grego from Senior Perspective. Thanks for listening. Bye-bye.